Ridgeview began in 1976. We have approximately 250 full-time employees, of which 60 have been here for 10 years or more. And it's because of them and our medical staff that has given us a reputation for quality and resulted in us thriving and surviving over the years. We ask the staff to deal with patients the way they would want members of their family treated, and that is with compassion, trust, and respect. Mental illness, addiction, and eating disorders are all deadly. They are life-saving, our programs.
I think that everything about Ridgeview offers an advantage to patients or clients that need to come here for treatment because, first of all, you get the highest quality treatment that you can get anywhere.
The Ridgeview Insitute Women's Program is unique. We're a very specialized treatment program dealing with eating disorders and women's issues in general.
Women are suffering from eating disorders. It's a very difficult situation. It's a devastating disease. So they come in very fragile and very sick and in very much in need of treatment.
A young woman that's coming in with an eating disorder, they've done a lot of damage to their body. They are at the point physically where they're severely compromised, not to mention the emotional impact that it's had on their life. Through the work that we do with them, we're able to get them to work past that crisis phase and begin to work towards what they can do to keep themselves at an okay level.
When the woman comes to Ridgeview for treatment, she'll go to an environment where she sees she is safe and secure, and she's going to receive compassion, trust, and respect. And I think that will remove some of the barriers and she'll be more receptive to treatment.
Anorexia and bulimia are the only psychiatric disorders that have a mortality rate. And arguably from 5 to 20% of people with an eating disorder end up dying from a complication from their eating disorder. When somebody has bulimia nervosa, it's time to consider treatment when they find themselves doing something that might be harmful, such as making themselves vomit, making themselves take pills, making themselves exercise to the point that they're exhausted. And the way that they sometimes become aware of that is when their day becomes more and more empty of things that are usually important to them, like friends or school or work, and more filled with either those activities or thoughts about those activities.
I came to Ridgeview because I was anorexic and really sick, and I needed help.
We found Ridgeview through the psychiatrist we took Marissa to. Our internist referred her to a psychiatrist within our network, and he saw Marissa and immediately referred her here to be hospitalized.
I think for me, the health had gotten to be an issue, and that's why you go into the hospital, because that gives you the time and puts you in a safe place where your mind can catch up with your body, you know, and you can have a place where they can both get better together. It was a life and death situation for a little bit there, and it was scary. You don't realize, like, having bad health, how much that hinders you from having any life. I mean, I was too tired all the time. I couldn't go out. I didn't feel like doing anything. I was always in a bad mood. And I think that started finally to hit me, that I was just missing out so much, and I was just tired of being sick all the time.
I felt that Marissa would be in a safe place and that we had taken a step that we were supposed to take.
I felt that Marissa was where she needed to be for intervention. It was a life or death matter, and I felt that for the first time since this started, the spring before she was hospitalized, I felt relieved that her care was not on our shoulders. She was in a place where she would be watched, cared for, and wouldn't be able to hurt herself. So I felt very safe about her being here.
One of the reasons that people come to Ridgeview is because we have a very specialized approach. With our women's program, we have 3 levels of care. We have an inpatient 24-hour-a-day stabilization unit. We have a partial hospitalization unit that's 5 days a week. Our 3rd level of care is an intensive outpatient program, which is 5 days a week, Monday through Friday.
Ridgeview doesn't really feel like a hospital, like a place that has, you know, the benefits of a hospital if you need it, but it's more of like a home. The greatest thing about Ridgeview is that they provided a lot of resources like groups outside of the actual hospital. I could find a doctor and I could find a therapist to keep seeking, and I could find other groups to be a part of. So when I got out of the hospital, I wasn't really left just like, what am I gonna do, you know, the minute I had a problem. I had people that understood and people I could talk to. Looking back on the things I have accomplished in my life, that is definitely the thing I'm most proud of in my life, is overcoming my battle with anorexia. I promise, if you put in the work, you know, and you trust these people that are willing to help you. I mean, you can get better. You really can.